The following podcast is taken from a live broadcast on Inspire FM.
Any health advice given, whether general, diet, physical or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum. Assalamu alaikum to all our listeners and viewers. I welcome you all to another exciting and educating edition of the Health and Fitness Show. I'm your host Fahad Matin for today's show, and I hope and pray that all of us are fit and healthy by the grace of Almighty Allah. I do pray that we all had a nice and positive week so far and looking forward for a nice and relaxing weekend. Maybe a long weekend for some people. Yes, indeed, because there are plenty of people going on holidays, but hey ho, there are a few people like us who are still working. This program is broadcasting live from the studios of Inspire FM today on 19th of December 2019. Yes, 1912-19. And casting its positive vibes to all our lovely people in Luton and all the surrounding areas of Luton, like Dunstable, Harpenden, Bedford. And our positive air is reaching to the listeners who are listening us through our Inspire FM phone app, or if they are listening us through our website. Also, if you like, you can view us via our Facebook page. All you have to do is just go to Facebook and go to the Inspire FM Facebook page and click the live link. And if you're listening to this show on Sunday or any other Thursday other than the 19-12-19, that means it's repeat. But hey ho, as it is 19th of December today, so it is not repeat. So let's cover our topic today. Basically, this topic is supposed to be covered by my fellow host, Sulaiman Rafiq, but unfortunately, due to some personal circumstances, he may not be able to join today. Hence, I am back on the hot seat. Right, so without taking any more time, let's jump into our main topic for today. So the topic for today it's slightly unique in many different ways. It is unique because we are talking talking about fertility and PCOS. Now, as I always say, I'm not the one who will be answering any of the questions. Luckily, I have two lovely guests with me today, one in the studio and one who will be joining me over the phone. The person who is with me in the studios need no introduction because she is what's the best word? She's brilliant in every single way. She's leading gynecologist and fertility section at Luton and Dunstable Hospital. And if I start praising her, I think so it will cover the whole hour of the show. Without mentioning any further details, let me introduce her. She is none other than Dr Shahnaz Akbar. Assalamu alaikum, Dr. Saab.
Walaikum assalam, Matin. Thank you very much for inviting me today.
How are you today?
I'm good, thank you.
And also joining us via telephone line is Caroline Andrews. Good evening, Caroline.
Good evening. Thanks for inviting us as well.
How are you today?
I'm good, thank you. Yourself?
Yeah, very good. Very good. Thank you so much. Right. So, as our shows traditionally, whenever we start our show, we talk about topic and we talk about our fellow host, our guests. So, as I always ask my guests to introduce themselves, tell us about themselves. So that is something which we will be doing today. So let's start with you, Shahnaz, because if I start talking about you, it will take me a whole day. So why don't you give us a quick snapshot of what you do as your work and how you're relevant for the topic today?
Thank you, Fahad. You are very kind. I'm Ms. Shahnaz Akbar. I'm a fertility specialist and a senior fertility consultant, as well as a gynecologist, an obstetrician, and a specialist in reproductive medicine and surgery. I offer treatments at L&D Hospital and help our population in the local area.
And as I said earlier, joining me via phone line is Caroline. So Caroline, can you give us a bit of intro about yourself?
I can. So my name's Caroline, and I'm actually a woman with PCOS. I got diagnosed in 2002 after about 3 to 4 years of what I now understand to be quite clear symptoms, and my role is actually as a volunteer trustee for Verity, which is a charity in England and Wales to support patients, help inform them about PCOS and empower them in terms of their ongoing treatment.
So let's jump into the topic, as you just mentioned about PCOS. So can you tell us what is PCOS? So let's start with you, Shahnaz, and then I'll ask Caroline as well. So Shahnaz, what is PCOS?
Thank you, Matin. It's
Fahad.
Fahad. Sorry, I apologize. Mr. Matin.
I always do that. So no problem.
Yeah, you did last time with me as well. Okay, sorry, Fahad. The PCOS is polycystic ovarian syndrome and is widely referred as PCOS. It's a common endocrine abnormality in women in their reproductive age, and it's affect about 8 to 20% of women in their reproductive age. And you want me to go more ahead about it? Okay, so
because I have not heard about it.
Okay, so it's usually called PCOS, and it runs in families. But it's not necessary. It needs to run in family, and it usually is observed around the time of late teens, then when they have delayed periods. Sometimes no symptom as such. They have just oily skins, thinning of the hairs or losing of hairs, and irregular cycles or no periods at all. Or sometimes easy to gain weight. So it is confused with lot of other conditions like thyroid problems or any other hormonal or endocrine problems. Sometimes it has no symptom other than that they have irregular cycles, or sometimes or most of the time when they are trying for pregnancy, then it is one of the cause because the egg is not released, which is called ovulation, is not happening to these young girls or women who are trying for pregnancy. As well as there are certain health consequences to this syndrome as well, as the hormones are disturbed in such a way that they are easy to gain weight, and when they gain weight, hormones get more disturbed. So because of the epidemic of obesity in the Western world, this syndrome is coming more and more up and more diagnosed. Before, it was a neglected syndrome. Nobody knew what was it because there were no criteria. Now we have a standard criteria to diagnose this syndrome. So they may have when they come to fertility, when they are trying for fertility and then come to the clinic, then we can diagnose them. And the consequences are that they may develop diabetes later in the life or during pregnancy, or they have high cholesterol levels and heart problem. They suffer from sleep apnea.
Wow! So it's like a problem of multi factorial. Wow! So amazing!
It is. We need to look after this woman very holistically.
Okay, so I do have so many questions in my mind now. It's a bit kind of hard to focus on it, but at the same time, so let me introduce. Let me go to Caroline as well, and I'll ask her how common is PCOS is.
Well, there's quite a number of different studies, and one of the most major studies that have been done in recent years was the international guidelines, which came out in 2018. That's mainly led by an Australian group, but it's an international cohesive that has done that. We've been involved in it as well as Verity, and they're showing statistics of 1 in 10 women have it. There is some ethnic differences. For example, studies are showing that South Asian women have a prevalence about 6.3% higher, whereas in Middle Eastern women it looks about 5 to 8% higher. So it's very common. I think the problem is a lot of people don't get diagnosed with it, so they're not necessarily recognised as having PCOS. Each individual symptom is treated, and as Shahnaz just said, it's when you actually get that holistic approach from treating the symptoms as a whole and looking for the underlying causes, does the PCOS diagnosis come up. A lot of people as well at the moment confuse it with ovarian cysts, which are a very, very different condition, and it is a case of actually looking at, have you got the symptoms of the polycystic ovaries, the excess weight, the alopecia, the skin issues, and the fertility struggle, and it's a case of looking at those symptoms all joined up. But it's very common, and I know myself, once people know I've got it, so many women talk to me because I've got that too as well. I didn't realise, and that is a very, very common thing. People don't realise they have it.
Wow. Now, as you have mentioned that there are high rate of these in a specific group like Asian and black and other ethnic minorities. Just out of context, Shahnaz, is it so what happens? So person or female who have this condition, can they not conceive at all, or they cannot conceive by normally?
No. It's not a hard and fast rule. Majority of the women who have got polycystic ovaries, not as a syndrome, they even do not know they have polycystic ovaries. Even those women who have polycystic ovarian syndrome, they conceive without realizing they have this condition. We only realize when it's difficult to conceive. So if they have a healthy lifestyle, like weight is not on the higher side, and all the other factors are good, like sperm cement is okay, and there is no damage to her tubes or any abnormalities in her uterus, and if her weight is fine, so most of the time they conceive. It's not that they cannot conceive at all, and all of the women should need help. So it's not the case. But if they are aware that there is something, then they should seek help sooner than later.
So is there any higher rate in any specific group? I know as Caroline just mentioned that there's a 6% in Asian and the other ones.
African.
So is there any other groups in terms of specific groups who have the higher? Are they on a higher rate in any specific groups?
Yes, as this syndrome is spread worldwide, all over the world. Every country has some different ratios, but overall, it is more common in the Asian population and African background. That's why diabetes is more common in Asians and the African. This is because, which we'll discuss later, about the insulin resistance in these groups.
Sorry, Caroline, you
saying. Interesting to note on that as well, that there also, from studies that we've seen, more issues relating to skin in terms of the Asian population. And I think where it's got to be conscious as well is it's difficult to talk to a doctor about the female reproductive system and the female endocrine system. But particularly there may be some cultural issues in terms of Asian women going to a doctor, having that access to the healthcare and being able to speak to them about this very, very personal issue and speak to family friends about it. I'm quite a good advocate on the situation because I've grown up around it. I've got friends and family who've got the condition, but if you're not used to it, you don't know what it is, it's embarrassing. It has been called the theft of womanhood on occasion because it doesn't make you feel good. There's emotional issues attached to it. This recent study in 2018 is even looking at psychological issues attached to it as well, and how it impacts upon yourself, and particularly where you are having fertility struggles, or if you're having weight issues or acne issues, it can be a horrible, horrible condition. Being able to talk openly about it and access that healthcare that you desperately need to join up all these docs to get the diagnosis can be really difficult.
No, indeed, I absolutely agree with you in many different ways because I've met one of my friend from a while back. Just recently, I've met her, and she was telling me about she had an underlying condition which she cannot conceive. So I was shocked and surprised as well, although that. It does not look like she's a person who may go through that. And then she gave many different examples. So again, it is a very fertility is something which is very high area of section where females, when they go to female patients who go to GP surgeries, even with the female GPs, they are not very easy to discuss these kind of things.
Yes,
Shahnaz,
right,
you have come across many patients like that.
As Caroline rightly said, these women are very anxious. They feel helpless. They think something is not right to them because of the disturbance in the hormones. As Caroline said again, that they feel very embarrassed sometimes, especially with some ethnic background. They think this could be a stigma because the most bothersome symptom is excessive hairs on the face, acne and hair loss and obesity, which is itself causes a body image effects and in turn causes all the psychological problems and depression, and it comes more worse when they're trying for pregnancy and they cannot conceive. So they feel like they're in a trap. So it is extremely difficult. So we have to approach very holistically, support them throughout. And I've noticed in my practice for many years that these women find extremely hard or difficult to lose weight. And when they come to the clinic, when their weight is measured, they feel so upset and depressed and rather helpless that they are doing every single thing but still they can't. So I support them beyond the need I have to do. So I have self-help groups and help them with the weight management. And when they lose weight, if everything else is fine, they conceive. So
Perfect.
that's
Perfect.
Just add to that PCOS isn't just in obese women. PCOS is actually 50% of the women with PCOS are of a
in
normal
the thin women
BMI.
as well. Yes.
Wow. Okay. That's
So
very
for
shocking.
that, if they are thin, then we have different management option, which we will discuss later in the
Definitely.
management thing.
Definitely. On this note, let me introduce our listeners as well. Listeners, if you have any questions or queries regarding PCOS, which is polycystic ovarian syndromes, please do give us on 01582 481822. I repeat, 01582 481822. Or you can send your questions via text messages or WhatsApp on 07779 481822. If you are a person who have gone through a similar kind of an issue or some kind of a problem in a similar lines, please do give us a call. We have two special guests, one via phone and one in person in the studios, who can help you or at least guide you in the same direction. Right. In terms of, as you have mentioned, Caroline, earlier, that you are part of a charity group called Verity?
Verity, yes.
Verity. So can you tell us more about Verity?
So Verity was set up in 1997, and it actually comes from the French called the truth. And our main aim is actually trying to spread the truth about PCOS, because there's a huge amount of myths and misassumptions out there. I know even when I first got diagnosed, I didn't really know much about it. And our role is to try and help educate women, empower them and their families to learn more about it, so that they're informed themselves when they are trying to access healthcare. We have to be, as patients, almost our greatest advocates to be able to try and access the treatment. There are some wonderful, wonderful health professionals out there who know about the condition, who are active, but unfortunately there are also some who look at a teenager or a young girl on her period and just think, period issues, that's it. Or teenage acne. So as Verity, we try and encourage people to learn about it, learn the real facts. So all our information is verified by a board of medical professionals, because Verity itself is actually run by volunteers who all have PCOS themselves, and very, very busy day jobs and families as well.
Okay. I do have a caller on the line as well who wanted to talk about his wife. So let's introduce our caller. Assalamu alaikum, Muhammad, I presume.
Hello.
Walaikum salam. Yes, sir, you want to ask something?
Yes. My name is Mohammed, and I'd like to speak about an issue faced by my wife, and it's been an ongoing issue for a while now. She gets pain in her lower abdomen, and the doctors think it is fibroids. Now, I've been listening to the show, and you, Dr. Shahnaz has mentioned some issues when females have it. They have, skin issues and weight gain and what have you. And she seems to be ticking off all the criteria that she's mentioned.
Mm-hmm.
And she does have an appointment for gynecologist.
Mm-hmm.
Now, I just wanted to ask, what's the difference between fibroids and PCOS you're talking about?
Okay. I'll direct your question to Dr. Shahnaz Akbar. Thank you so much, Brother Mohammed, for coming on the show.
Thank you.
Yes.
Thank you, Mohammed. Assalamu alaikum. Yes, are you trying for a pregnancy as well together?
Yes.
Okay, so fibroid is nothing to do with PCOS, but can affect fertility as well. So look like the fibroid, it depends where it is. It is a small benign or swelling in the womb, which may affect the fertility or have heavy periods. If it is outside the womb, has less effects, but depends how many are there, where they are, and what is the size. So does your wife have heavy periods?
Yeah.
Okay. And has anybody have any discussion regarding polycystic ovarian syndrome yet? Sorry, it appears we are cut off.
Hello, Mohammed, are you here? Sorry,
I'm.
So, Mohammed, to summarize, if your wife is fulfilling all these symptoms, I think you should, or if you're trying for pregnancy, so your GP should refer to, if you are local, to Lieutenant Dunstable Fertility Center, where we can look. So we have a holistic approach to look at what is causing. And if it is due to fibroids, we can sort the fibroids, or if it is underlying cause for fertility as polycystic ovaries, which we are just presuming. So we may have to exclude other conditions, as well as if your wife's weight is not in the normal range, first thing she should do to lose weight, and GP should perform some hormonal test on your wife during her periods, and then we will see in the clinic. And I'm very happy to look after you in my fertility clinic. I do general gynae clinic as well, so it's better we could see you as a couple in the fertility clinic.
Okay. Thank you so much, Mohammed.
No,
yeah.
I would add, both PCOS and fibroids are both very common conditions. I actually have both myself as well. We find a lot of women have PCOS and endometritis. So it is something, if you've been diagnosed with one thing, do push with the doctors. So look, we're meeting up with these criteria of the symptoms of something else. Can we be investigated for it? Sort of push for it yourselves, because sometimes if you've got one diagnosis,
it's not necessary to push, because if the doctor is looking to compare comprehensively, doctor will do the baseline investigation and try to find more advanced tests. So I'm more than happy to see you as a couple in the clinic, in the fertility clinic, and assess if there is any polycystic ovarian syndrome, is the fibroid, what type and size, and what else is affecting the fertility.
Okay. Does PCOS lead to extreme pain?
Sometimes when there is ovulation happening, occasionally severe pain can happen, but it could be related to the fibroids as well, could be related to underlying cause as endometriosis or something. So we can't just say this, we will have to assess you.
Okay, thank you so much, Mohammed.
Where can I get the information about your clinic?
You can go to your GP and tell, I work at Lieutenant Dunstable Hospital and private centers as well, like Spire Harpenden. So you can, and one-stop doctors. So I think best is to your GP to refer to Lieutenant Dunstable Hospital if you're happy.
For the fertility services, and they can guide you. And if they ask for Dr. Shahnaz Akbar, they can definitely refer you to them. Okay?
Thank you.
Thank you so much, Mohammed, for joining us today. And as we are about to go on a break, and Caroline, I know you were just there for first half of the show. Can you quickly tell us about your support, the available support?
So Verity has a number of supports. We've got online active Facebook groups and discussion groups. We also have active local groups. Unfortunately, there's not actually one in Luton at the moment, but if anybody wants to set one up, we're more than happy to help. We've got a great local group leader who does that. We do have some in Berkshire and London at the moment, which I think are the closest. But we provide information packs. We help to raise awareness links with the government and local fertility groups as well. And it is really a case of going to our website, which is www.verity-pcos.org.uk. That leads you to all the other groups, our Twitter, our Facebook, social media. There's a brilliant TV programme on Islam Channel, on Women's AM on YouTube, which we partake in on exactly these sort of issues in terms of PCOS in Asian women. So it's well worth a view of that. But we're really here just to try and help empower women so they can get the access to the healthcare that they need.
Thank you so much, Caroline, for joining us, and thank you so much for all your help. And
thank you very much for doing the topic.
Thank you so much. And this is all our show for the first half. We will be back after these very short messages.
You're listening to an Inspire FM podcast, making available our popular programs from our daily broadcast on Inspire FM.
Any health advice given, whether general, diet, physical or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum to all our listeners and viewers. Definitely good evening. Welcome back to Health and Fitness Show. I'm your host Fahad Matin for today's evening. And we are talking about polycystic ovary syndromes as well as the fertility sections. Today with our guest, Dr Shahnaz Akbar from L&D Hospital. This program is broadcasting live from the studios of Inspire FM today on 19th of December 2019. And reaching to all our lovely people in Luton and the surrounding areas of Luton like Dunstable, Harpeth and Bedford, i.e. whole Bedfordshire. Also, our airwaves reaching all our online listeners as well, who are listening us through mobile apps, Facebook, mobile Inspire FM app, and as well as Inspire FM Facebook links. And definitely you can view us live through Facebook by clicking on Inspire FM Facebook page and click the live link. As we were talking in our first hour, this is our second part of it, and I must say, wow, the time has passed so quickly. The first hour just gone. It is really hard when the full first hour just gone, and you did not started the topic halfway through the whole thing. But anyhow, as it stands, the whole first hour has gone. In the first hour, first half hour, we talked about PCOS, also known as the polycystic ovary syndromes, and definitely in the first half hour, we had Caroline from Verity who had joined us, as well as Dr Shahnaz Akbar, and they talked about the whole thing. We are also thankful to a caller who just called in regarding an issue, and alhamdulillah, he is also satisfied with the answer. So, without further ado, let's introduce our guest. She's none other than Dr Shahnaz Akbar. Assalamu alaikum, Dr. Akbar.
Walaikum assalam, Fahad.
How are you, sir?
I'm good, thank you.
So, thank you so much for your time. Every single time whenever you comes in, you always give a new information to me, and there are so many new things I always learn from you. So, thank you so much for
it's my pleasure, and thank you for inviting me.
You're always welcome, and as I said, you're always whenever I talk about you, I end up singing praises, and which is not wrong either in many different ways. So as we were talking about PCOS in our first half hour, and the second half which we have kept for fertility, but as the caller who called in earlier talked about complete two different issues. One is fibroid and the other one is fertility, which is linked into both areas because it is. So let's capture the whole thing altogether, and then touch the whole thing in a holistic way with PCOS and fertility. What do you reckon?
Yeah. Yes, that's good.
So, as the second half was fertility. So, let me start by asking you, what do you mean when we use the term fertility?
There's fertility, meaning ability to conceive and produce an offspring. And when you are unable to do this, it's called infertility.
And what causes infertility?
Infertility, out of 125 couples have no cause, and it's called unexplained. And about 30% or 1/3 of couples is related to male factors, which could be semen problem, either low semen count, less semen count, no sperms at all, or problem with the movement of the sperms, or shape and size of the sperms are not good, like abnormal sperms. And they account for about 30% of cases. And then in the female, most common cause is ovulation problem, which means that lack of production of eggs, which is called ovulatory infertility, which is mostly PCOS. Other factor could be the tubal factor, which is again about 20% of cases, which means the tube which is connect the ovary to the uterus, which is womb, and transport the eggs, and where the sperm and egg meet. If there is a problem with the tube, then that accounts for about 20% of cases. That could be due to previous surgery or previous pelvic infections or any damage to the tubes that can cause. Other 10% causes could be related to the uterus, as we just discussed, could be fibroids or congenital malformations or anomalies of the uterus, or other condition we just touched, like endometriosis, when the lining of the womb leaks outside the womb and implant outside and can cause problem. So these are the general overall causes which couple can have. Sometimes they don't have any cause, which is called unexplained infertility, which could be due to stress of not getting pregnant, or they go into a mode of stress. So that we really need to look into and support the couple holistically.
So in general cases, how many of those you have given so many symptoms and so many different conditions? So how many of those people who have gone through those problems can have an offspring or can have a baby?
Like we know that infertility issues are increasing, and in the United Kingdom, 1 in 7 couple have some sort of issues.
Wow.
Yes.
1 in 7?
1 in 7. And it is increasing, and it is because of various reasons as well. More important is the lifestyle. Couples are delaying their pregnancies because of their career and other issues, or they have some delays. They delay due to their professional reasons or personal reasons, or because of the lifestyle as well. Sometimes we work and don't realize what we are eating and don't look after our weight. That can affect, as well as some associated conditions can affect.
Right, okay. Let me introduce our listeners as well. So, listeners, if you have any questions or queries regarding our topic tonight, which we are talking about fertility as well as the polycystic ovary syndrome, please do give us a call on 01582 481822, or you can send your questions via text messages or WhatsApp on 07779 481822. Are you one of your family members been going through this, or if you are part of this, or if you have gone through any of these conditions, if you have your personal experience, you're more than happy to share with us those as well. So just send us a text message, or if you have any questions or queries, or if you have your own experience gone through this whole process. But please get in touch with us. Right. So, Dr. Shahnaz, one of the things which people do feel or they want to know is the treatment, and they ask treatment, what treatments are available, and so forth. So is there a variety of different treatment for different conditions, or they are just one treatment?
Is it treatment regarding PCOS or regarding fertility, or both?
Both, because as they both are intertwined in some cases.
Yes.
So let's talk about both.
Let's talk about PCOS. PCOS, to be honest, there is no cure. So the aim of the treatments is to manage their symptoms and help. For example, if they are trying for pregnancy, so we make sure that everything else is okay, like the sperms is perfectly within the normal range. There is no abnormality in the uterus or any damage to the fallopian tubes, and her body mass index, which is weight and height calculated, which is within the normal range, meaning less weight on the lower side. Then we give some tablets, fertility tablets, from day 2 to day 6 of period, which is usually called Clomid or Letrozole, and then hopefully they get successful. If not, then sometimes we use the injection to stimulate the ovaries to produce egg. If not, then we go for IVF, which is called in vitro fertilization, where we take the eggs out after stimulating the woman's ovaries and mix with the sperms if they are healthy. If they are not moving properly or have some abnormality in the shape and size, then we select the best sperm and inject directly into the cytoplasm of the egg. When fertilization happens, we select the best embryo and put inside the womb. So this is for fertility. If they're not trying for fertility and have problems, we just mentioned before that if they have just irregular cycles, so we give hormone pill, like combined contraceptive pill. If they have any contraindication to the pill, like estrogen part of the pill, sometimes we give just only progesterone pill, which is called mini pill, or sometimes we put the hormone coil called Mirena IUS. And if they have skin problems, usually if it's a hair growth, excessive hair growth, so we give some cream called Vinica cream, which slows down the hair growth. But most of the CCGs locally do not fund this cream. But or sometimes they can have laser treatment, or for acne there are various remedies. But if they are obese, if they lose weight, it will help with every single symptom. The skin gets better, the oily skin get better, the cycles get better because ovulation is happening, and fertility issues get better. So this is for polycystic. And if they are thin and trying for pregnancy and is not ovulating, sometimes we do a surgical procedure called ovarian drilling, when we put a telescope, it's usually called a keyhole surgery, and we heat by using the heat, which is called diathermy, to puncture those cysts, and it helps with ovulation and they conceive. So this, and for fertility issues, if it is not polycystic, or if it is related to polycystic ovary, so they get pregnant hopefully with the treatment I have just mentioned. But if it is due to other causes, still we go for IVF.
Wow. Okay. And I must say it's not an easy thing to go through. And is there different treatment for IVF as well?
Yes, we got lots of advances in the in vitro fertilization. I just mentioned one is called ICSI, which is intracytoplasmic sperm injection when there is a male factor in fertility. There is another one called IMSI, when we select the best morphologically looking sperm and inject. So this is all in vitro fertilization, and then we select the best embryo and we grow the embryos now to day 5, which is called blastocyst, which is the time when naturally it implants into the uterus. And we got good success outcomes.
Wow. And I must say, Shahnaz, you do have experience, first-hand experience to see those struggles in fertility. And can you please tell me what can these the experience you have firsthand, the struggle of infinity, what is the cause of those infertilities, and what is the role of your department in that?
Okay, when couple is trying, studies have shown if they are young and healthy couple, after trying for within 12 months, 80% can get pregnant, and those who did not in second year, 80 to 90% get pregnant. So if there is no concerns at all, so they should have a healthy living style and try. If after 12 months, if not, but if they have, she has polycystic ovaries or any problem before, like pelvic inflammatory disease or history of endometriosis, then they should not wait for 12 months. GP should refer them. So when we have a referral in our clinic, as a senior consultant in my department, I have generated a self-assessment questionnaire. So as soon they self-assess, they'll give us all the information about. And then first thing before I see them, my nurse weigh them to check the weight and the BMI. And if they are smoking, we check the carbon monoxide levels. So then we assess and do the baseline test. And most important thing is for them to relax. So when I was in training for fertility, I realized that it is a very stressful thing for both for the patient and for the clinician. So as a part-time student, I went to South Bank University and did the counseling qualification, which really helps me as well as my couple. So when they come to me, they relax. And if it is due to their anxiety or nervousness, most of them, they relax and get pregnant. So I do baseline tests. So first thing is the sperm test, and then the ultrasound scan of the pelvis to exclude any ovarian cyst or polycystic ovaries or fibroids. And then if everything is okay, we check the fallopian tubes. And if it is the cause due to PCOS, then we give the fertility medication as discussed. If we find some cause like sperm problem or tubes problem or anything else, then we go straight for IVF. But before IVF or any fertility treatment, if the fibroids are affecting the cavity of the womb, I treat them. I remove them either by telescope or by open surgery. So, and then sometimes or if there is any endometriosis, I treat them before. And studies have shown if you have fertility improving surgeries, they can be very beneficial. So when we do treat for fertility, there are three domains. One is medical treatment, just like we discussed with PCOS, and if it's sperm problem, give them some antioxidant. Or surgical treatment or treatment of the endometriosis, removal of the ovarian cyst or removal of the fibroids. And if everything is not working, then go straight for IVF.
And in terms of people who are going through this, I know there are people who normally have problems and issues regarding that awkwardness and it's not that easy to have those things linked in properly. So what I wanted to ask is if a couple comes to you, do you have any case studies which you can share with us?
Yes.
Any difficult ones?
It's not difficult. I will tell you the very simple one. And recently, so I had a couple who were trying for pregnancy for 13 years. And she had PCOS. So I'm giving this example because we are talking about PCOS today. So unfortunately, she had 2 miscarriages. After that, they tried, nothing is happening. So they were discharged, then came back to me again. And so her weight was on the higher side. I checked, make sure that her husband's sperms were good and tubes were okay. So I work hard with her to lose weight. So I in my previous fertility show, I did mention that I developed the link with Luton Total Wellbeing. So we work very comprehensively to work with the couple one-to-one and lose weight. So when she lost weight, she came to my clinic. She said she's not having periods. I said, did you do a pregnancy test? She said, yes, it was 2 weeks ago. It was negative. And I was planning to offer IVF. I said, no, she has lost weight. And but I said, let me do a pregnancy test. And we did a pregnancy test, and she was pregnant without IVF. So it was a very happy day for both of us. So I was very pleased. So just this example is that if everything is fine, if you lose weight, even if you lose 5% of your body weight, 80% chance that you get ovulation. If everything else is okay, you get pregnant. So that was a very happy ending for me and for the patient, my lady.
Mashallah,
definitely. I'm very happy for this.
Exactly, indeed. And in terms of the, if you remember on the first part of this show, a caller just called and he were talking about his wife, problems going through. And he did mention that his wife got a referral to gynecologist.
Yes. Yeah.
So does he need to go back to GP surgeries to get a separate referral for
two
your
options.
clinic?
If seeing the gynecologist, then they should request that to be referred to the fertility clinic, so we can manage the gynecological issue, which is supposed to be fibroid, as well as fertility. So it is better, because I do my own surgeries and do my own gynecology, so that couples have everything under one umbrella. So they should ideally be seen in the fertility clinic, and then we can do the surgery if needed according to relation to their fertility issues. So I suggest they should go to GP and be referred to the fertility center, or if they can have an appointment in very near future, then tell the gynecologist who is they are having an appointment to refer to the fertility clinic.
Okay, so that's the answer to our caller as well, that if you're already going for an appointment, please do speak to your gynecologist to be referred back into
the fertility
clinic, so at least
they don't need to go to the GP.
Yeah. Wow. I must say, time has passed so quickly. We just literally have 4 minutes in our hand before the end of the show, and I have a ton of questions in front of me. I just want to shed some light on the PCO side, because you did mention earlier that PCOS can link with insulin, it can link with fertility, it can link with diabetes, change of mood swing as well. So if I ask you to summarize this in a 2 minutes time.
Okay.
I know it's a very big ask.
No. So fertility, the PCOS is associated with insulin resistance. Insulin is a hormone which is secreted by pancreas to control the blood sugars. So it allows the cells to use the glucose to provide energy. So in cases of PCOS, the cells are resistant, so that pancreas produce more insulin. So insulin level goes up, and when the insulin level goes up, it disturbs the hormones, increase in weight, and cause all these problems. So when the insulin is high, weight gain high, more in disturbed hormones, more irregular cycles, less production of egg, and all the symptoms get more obvious and more worse. So there are certain suggestion which is not licensed, that we give metformin as well, which sensitizes the insulin. And those women who are PCOS, I suggest they should take anofolic, not folic acid. It is a myoinositol derivative. They can buy online as well, which helps regulate the insulin, allows the cells to use the glucose, and when the glucose is used, insulin levels goes down, and when the insulin level goes down, the hormones levels get better, and they produce egg cycles get better, skin get better, hair loss get better, and they conceive. So it's called anofolic, INOFOLIC, anofolic, and they can buy online as well or discuss with their GPs.
Wow, anofolic.
Yes, that's very good.
So here you go, guys. If you think, or if you've been diagnosed with PCOS, please do get in touch with your GPs,
or come and see me at Luton Dunstable Hospital.
Or definitely ask your GP to refer you to the to Dr Shahnaz Akbar, and definitely have a word with her regarding that, because it does help a lot in many different ways, and it kind of. It's better to get the help now, and sort things out now in this part of the life, rather than leaving it to later time, or the later part of your life, which will create more problems. And as Dr. Shahnaz said, Dr. Akbar said that it can lead to diabetic.
And then because of this insulin resistance, there is also a metabolic syndrome happens, like high cholesterol levels, diabetes, and gestational diabetes, and pregnancy problems like preeclampsia, high blood pressure, big baby, and sudden death of the baby inside the mother before delivery. And they also suffer from sleep apnea, which is a risk factor for cardiovascular accidents, so they may have heart problems. So most important take-home message from today, if they have polycystic ovarian syndrome, which is called PCOS, and weight is on the higher side, they should lose weight. And all the PCOS women who are not obese or those are obese, they should use low GI diet called low glycemic index diet that helps help, and they should have lots of exercise, plenty of fluids, and avoid carbohydrates.
Wow, I must say that is something which I need as well. So I need to lose weight. But yeah, that is really interesting because one thing which unfortunately in our culture, if a woman can't conceive, they all blame unfortunately goes to that poor girl, and nobody try to think the other side that it might be a guy's problem
so because about 40% of couple both have problems.
So if it's a guy problem, can guy
of course. There are lots we can help because the sperm problem can happen for various reasons, like if it's smoking, any medical problem, or obesity, or any metabolic condition like diabetes and things. So we can help, like long hours of driving, office job, consumption of alcohol, or heavily smoking. So we help with that. And at Luton we have a dedicated smoking cessation program on site as well, which I'm very pleased. I developed the link with Luton Total Wellbeing. So it really works well. And it's not the end of the world. If we can't improve on all these antioxidants and all these lifestyle changes, there is always an option of IVF, which our ICSI treatment, and our couples are getting successful.
And definitely this is something which I do want to speak to you, but unfortunately we do not have much time today. We're just literally finishing our show. So inshallah, when we come back again in the new year, I will definitely be calling you, and hopefully you will be getting a slot in either February or January time. And definitely we will be having a big discussion on IVF as well as all the areas which we did not manage to cover today. But on a serious note, thank you so much, Dr. Akbar, for coming to our show, and thank you so much for Caroline, who joined us on the first half. Dr. Akbar, as we are literally finishing our show in a minute's time, final thoughts.
It's just I wish everyone Happy New Year, as well as wish them all the best if they're trying for pregnancy, and if they need any help, ask GP to refer to me directly to Luton and Dunstable Hospital, and where we look at them. We offer treatment not as a blanket treatment. We tailor the treatment according to the needs, so it's one-to-one and tailored and individualized treatment we do offer. So.
Thank you so much, Dr. Akbar and Dr. Shahnaz Akbar, for joining us today and giving us such a valuable information. And guys, if you have any issues like that, please ask your GP to be referred to the gynecologist department to Dr. Shahnaz Akbar, or fertility department to Dr. Shahnaz Akbar. Thank you so much, Dr. Shahnaz Akbar, for joining us today.
Thank you so much, Fahad. It was a pleasure, and thank you for inviting.
Thank you. That's all for us today, guys. Thank you so much for joining us. If you missed any part of the show, please don't. You can listen on Sunday. But till next week, I'm Fahad Matin. Assalamu alaikum.
Thank you for listening to our podcast. We stream our daily broadcast on inspirefm.org. You'll find all our daily updates on our social media at Inspire FM Luton.